to discuss about the methods to screen blood pressure. As an introduction, arterial blood pressure can be defined as the lateral pressure exerted by the moving column of blood on the walls of the arteries. Coming to the significance of the blood pressure, it is done to ensure the blood flow to various organs, which plays an important role in exchange of nutrients and gases across the capillaries, which is required to form urine. Then the blood pressure is also required for the formation of the lymph. Coming to the normal values, normal adult range can fluctuate within a wide range and still be normal. The systolic diastolic range or the normal value of blood pressure measured is usually 100 bar 60 to 140 bar 80. The systolic blood pressure or the SBP is defined as the maximum blood pressure in the arteries, which is attainable during the systole. Normal blood pressure is 120 plus or minus 20 mmHg. This is mainly contributed by the force of heartbeat, normal blood volume and cardiac output. Normal range is 90 to 140 mmHg. Coming to the diastolic blood pressure, as we are defining the diastolic blood pressure as the minimum pressure that is obtained at the end of the ventricular diastole. Normal range is from 60 to 90 mmHg. The diastolic blood pressure represents a constant load on the arterial walls with little or no fluctuation at all. It is an index to the peripheral resistance and decides the filling of the coronary system. Coming to the pulse pressure, it denotes the difference between systolic and diastolic pressure. Pulse pressure is equal to systolic blood pressure minus diastolic blood pressure, usually is 40 mmHg. Mean arterial pressure. The mean arterial blood pressure is equal to the diastolic blood pressure plus 1/3 of the pulse pressure. Usually the normal mean arterial pressure will be 95 mmHg. Not the arithmetical mean but the geometrical mean. It is because the period of the systole is only 0.3 seconds when compared to 0.5 seconds of the diastole. Coming to the physiological variation in blood pressure, the factors that influence the physiological variation are mainly age, build of the body, climate, diurnal variation, exercise, fever, gestation, high altitude, infusion or intake, pain, posture, sleep, and sex. Coming to the recording of blood pressure, there is direct method and indirect method. In the indirect methods, there is two types: palpatory method and oscillatory method. Discussing more detail about indirect methods, these are methods developed by Rivaracki using a sphygmomanometer. In the palpatory method, we use feel as the method to measure the blood pressure. That is, it is done by taking the radial pulse while inflating the cuff. The systolic pressure is where the cuff pressure cuts off the pulse. Hence, no pulse can be felt. The limitation of the indirect methods is that it cannot. That is in the disadvantage of palpatory method is that it cannot measure diastolic pressure. The advantage of palpatory method is that it provides a wise instrument in a patient suspected of hypertension. That is silent period with the Korotkov sounds. Then the oscillatory method, which is developed by the Russian scientist Korotkov. It involves listening to Korotkov sounds using a stethoscope placed over the brachial artery in the antecubital fossa of the elbow. When pressure exerted by the cuff uh, is much bigger than the pressure of the systolic pressure, there is no blood flow, hence no sound will be there. The pressure much lower than systolic pressure, this leads to blood forcing its way under the cuff for short periods at the beginning of the systole when the pressure is highest. Blood flow sounds are turbulent and move in a high velocity. This causes the sharp tapping, that is the first Korotkov sound that can be heard. It is the systolic pressure. Pressure in cuff falls lower and lower, the sound, that is like lubbed up, becomes louder, then diminishes as you hear the change in sound from a tapping to a muffled sound, and then thereafter to silence from this is the diastolic pressure or the fifth Korotkov sound. Here you can observe the principles involved in the recording of blood pressure using oscillatory method. These are the commonly used measurement devices. As you see, this is the recommended blood pressure measurement technique. The first step is to here the patient should be relaxed and the arm must be supported. Ensure no tight clothing constricts the arm. Then the second step is the cuff must be level with the heart. If the arm circumference exceeds 33 centimeter, a large cuff must be used. Place stethoscope diaphragm over brachial artery. Then in the third step, the column of mercury must be vertical. Inflate to occlude the pulse and deflate at 2 to 3 minutes and measure the systolic, that is the first sound, and the diastolic, that is the disappearance, to nearest 2 mmHg. Coming to the direct method, it is the most precise measure. It has a direct connection to major artery to a transducer via catheter. So that's all for the class for today. Thank you.